In this video, I'm going to dig into some of the biological reasons for depression. So if you're dealing with post-acute withdrawal syndrome and you feel like you're doing all the things right with self-care and cognitive reframing using the thought models, then sometimes you have to dig a little deeper. So I just want to recap basically the understanding that physical and mental health, there's no difference. And when we feel physically sick, we know there's something wrong with our body. And yet when we have mental health symptoms, somehow we think there's something wrong with us and we internalize that. And that's a huge part of the problem. So if you can get to a place where you recognize your symptoms as being no more emotionally charged than, say, a runny nose or a stomach ache or a migraine, then you can begin to move forward. And just as the right answer often when we're physically sick is to rest and heal, so is the answer kind of the same with our mental health. So again, to recap the why thought models don't always work, we use the hypothesis in those models that the thought triggers an emotion, and that emotions are just physical sensations in our body. Yes, but what's creating those physical sensations in our body? Well, emotions are also are actually triggered by neurotransmitters, and neurotransmitters are proteins made up of amino acids. So if your brain chemistry is not producing adequate amounts of those amino acids and the building blocks aren't there, then it doesn't matter how many times you think a positive thought. If you don't have the ingredients for dopamine, you're not going to get it. And there's, of course, other functionality, maybe dopamine's being produced but not accepted. I mean, we're just talking conceptual here. It's just important to consider that if your brain isn't functioning properly, it's missing some ingredients. And that's what I'm going to talk about in this video. So if you have negative thoughts that are stuck on repeat, or you're not getting the endorphins and the dopamine and the serotonin that's creating a manageable mood for you, then what can you do? Before I get into nutrition and amino acid supplement, I just want to take a moment to address the medications that we often get from our doctors. Many of the people that I work with are already on medications when they come into the program. And then some people, because they hit the skids with the post-acute withdrawal syndrome, PAWS, they are considering seeking drug support from their doctor. And I want to preface what I'm about to say as a no judgment, and also really nobody even knows. So it's not even that there's no judgment, there's actually no right answer. There's what you do and what you don't do, and then how that works out next. That's it. It's just cause and effect. And unfortunately, especially when it comes to mental health medications, much of our treatments require a lot of trial and error. Starting on a drug, working with the dose, it's not working, starting another drug. Many of you have experienced the revolving door back to the physician's office, and it's not all that fun, but sometimes it's necessary. I'll share my personal story really quick. I tried to go off my drug about 2 or 3 months into sobriety and went 9 months without it, and basically cried in my soup every day, and I wasn't bouncing back. And so I didn't know what I'm about to share with you in terms of amino acids and nutrition. And I also wasn't open to nutrition things. I was a kind of a staunch plant-based / vegan for many years, and I wasn't willing to change that. And so going off my medication, being willing to change my diet, not knowing that there's supplemental support, it was a little bit of a train wreck. Can't say it was bad. I didn't go back to drinking. I was still happier than I had been, but it was hard. But again, that was my trial and error. And so just know that I want to support you in whatever road that you want to take. And there's no one way up the mountain. Your road might be long and windy and somebody else's may be short and quick, but you can't really know until you get going. If you're interested in doing a deeper dive in terms of psychiatric medications, check out Robert Whitaker's Anatomy of an Epidemic. That really opened my eyes to kind of a hindsight view of what I have been through. Short-term outcome studies show improvement with many drugs. But the long-term studies, what few and far between that there are, show that the more medication you take and the longer you take it, the worse you do. And that includes really intense mental disorders like schizophrenia and severe bipolar, that actually long-term unmedicated patients fare much better. And that's scary, and also maybe just a hint of relief, because if you get into a position where you've done all the things and there's no other answer, then you can allow for short-term medication without the fear that you're going to, suffer in the long term. The truth is that many people can use medications in the short term safely and effectively, and it creates a bridge for them to get where they're going. So if you're suffering and that seems to be the next right thing, then just do what you need to do. And if it works and you feel better, then you can reevaluate after a certain period of time. I will give you my observation that does morph into a little bit of, advice, which as a coach I try to stay away from. But I will say that, especially in the first year of sobriety, if it's not broke, don't fix it. So if you have a really intense desire to, you've kicked alcohol out of your life and now you want to get off all drugs, understand that stabilizing your brain chemistry is the way to be successful. And post-acute withdrawal syndrome, your brain chemistry is not stable. So if you're on a drug and your brain chemistry feels stable, the AA wisdom of don't make any major changes or decisions in the first year can really be something that you should take to heart. Doesn't mean that you shouldn't go off it. And honestly, when I jumped into the pool after 3 months of sobriety, I was like, I don't care. I'm struggling right now, and I might as well embrace the suck and do it all at once. And ultimately, I wasn't successful. But had I known what I'm about to tell you, things might have been different. So make room and do what you want, but just understand that to check yourself, if nothing's broke and you're on a medication and life is going okay, maybe don't rock the boat. Unless you understand that you're rocking the boat and you're in for that, then go for it. So before I continue into some amino acid supplements that can help alleviate symptoms of depression, mood disorders, anxiety, all of that stuff, I do want to put in a note of caution here that if you are taking an SSRI, especially if you're taking more than one, that using amino acid supplements can be contraindicated, and that you need professional support if you're going to bring those on board when you're taking your medication. Because there's something called the serotonin syndrome. And this book is called The Mood Cure. If you're interested in reading more about what I'm about to talk about, there's The Mood Cure, which is where I'm getting a lot of my information, and then 7 Weeks to Sobriety. Both of these books are going to give you far more information than I am. This is a very broad-based overview and maybe some personal experience of what's helped me. Getting those books is a good place to start, because not only do they talk about recovery from alcohol use disorder, but they also talk about weaning and tapering off of SSRIs. So do more homework if you are one of those people with the overlap. One more thing before I move into the actual amino acid supplements. Those authors of those books are running rehabilitation programs that are very unusual in that they not only do the, traditional recovery education, but they're also addressing nutrition and using amino acid supplements to boost what we can't get from a diet, especially when we come into recovery kind of so deficient and kind of whacked out. And they're getting amazing results. When the rehab program incorporates nutrition and supplements, 94% of the patients, clients, when they come out, are experiencing no anxiety, no sleep problems, tremors, dizziness, shakiness, or depression at the time of discharge. 94%. So this can be a very highly effective tool. And 3.5 years later, 75% of those people are still sober, which is phenomenal in terms of results. Many rehab programs are less than 10%. I think the average overall is below 25% at the most. So to have a 3.5 year sobriety rate of 75%. And the good news is with amino acid supplements, this isn't something you have to do for the rest of your life. It just helps the transition. It's a bridge, if you will, that allows your brain to begin to focus, begin to function better on its own. So I'm going to keep this very simple and just give you the 4 places to start. You may start with one, you can start with all 4. We're going to have an amino acid for dopamine, one for serotonin, one for stress, and one for cravings. They're very, very safe. So except for interactions with potential SSRIs, you can safely take as much of these as you want. And I'll explain how to dose them, but just understand that you just take as much as you need and just use your body as cues to decide, okay, am I achieving the goal or do I still need more? It's very safe. Just think about vitamins. If you take too many vitamins, the worst case scenario, like vitamin B for me, I might feel a little nauseated, or later my pee is orange. That's it. Nobody dies from vitamins. So I'll start with dopamine and the dopamine deficiency problem, because almost every single person that comes into recovery is dealing with a dopamine deficiency, because any addictive substance, whether it be alcohol or other drugs, amphetamines, also things like caffeine and sugar, anything that artificially stimulates our dopamine levels causes the brain to downregulate the normal production, which is why we end up feeling really flat. In fact, dopamine deficiency symptoms feel like you're getting too much sleep and yet you're having trouble getting out of bed. You feel distracted by a lack of focus and concentration. You're feeling numb, apathetic, and blah. That describes dopamine deficiency. And if you're later in recovery, like for me, I don't think that I'm struggling with a dopamine deficiency anymore. I'm more of serotonin, which I'll talk about next, but the dopamine deficiency can actually take 14 months on average for the brain chemistry to recalibrate and dopamine production returns to a normal state. This can be accelerated with using supplements. And the primary supplement, first try, and again, refer to those books if this doesn't work for you, but 85% of people are successful with L-tyrosine. And it's actually just tyrosine, but there's 2 forms, L and D, and you'll always want to look for the L forms. And anything I'm talking about in this video, it's always the L forms. You can get these in 500 milligrams or 1,000 milligram capsules. I have 1,000 here because I went through the 500 and I knew that I needed the 1,000. But starting with the 500 is a great place to start. And the way you dose is you take it in the morning and you'll take 1 capsule to start. Now with that, if you're drinking coffee and eating sugar, then you're not going to notice the impact as much, because caffeine and sugar, to a much lesser extent than alcohol and other drugs, but it jacks your dopamine levels up. And the withdrawal of any drug is the opposite of its effects. So with caffeine, you feel more focused and you feel energized. And so a lack of focus and a lack of energy is on the downhill slide in the mid-afternoon. So to really stabilize your mood, you want to eliminate as many dopamine surging substances and behaviors, if possible, as you can, just to get the best results. So tyrosine is for dopamine. And again, if tyrosine doesn't work for you, there are farther upstream amino acids that might, but you want to consult those books for more information and a more individualized approach. Next up to look at is serotonin. And some researchers estimate that 80% of adults in the United States suffer from inadequate serotonin levels. And, this isn't a Prozac deficiency problem. It is really more of a nutritional deficiencies, an inadequate diet, really high stress, hormonal imbalances, and all of those sorts of things. However, it's very real how it feels. Serotonin is what's responsible for transmitting our positive feelings and thoughts. So when we're in short supply, we either get stuck in negative thought cycles or we just feel blank. Mental symptoms of this situation include depression, poor sleep, low self-esteem, OCD, anger, fear, and anxiety. Physical symptoms include the gut, heart problems, sleep problems, fibromyalgia, certain pain conditions, and really intense cravings for carbohydrates, alcohol, and drugs, and other drugs. So the first line of defense in the amino acid group for serotonin deficiency is 5-HTP. There we go. And 5-HTP has been established as safe, and actually when put up against Prozac in terms of antidepressant, if you will, it repeatedly either matched or outperformed the Prozac and other established antidepressants without any negative side effects. So when you take this, you might feel better within 15 minutes. But if you don't, you can up your dose. I think you can safely take 300 or 400 milligrams per day. So I have 200 milligram capsules, and I'll take one in the morning, although one dose is 2 capsules. So always be sure to check your dosage. But I'll take a dose in the morning, and then I'll usually take a dose in the afternoon again if I need it. And that serotonin deficiency is probably a little more common for people who have gotten through the bulk of the dopamine deficiency and are now moving into real life and I still don't feel good. Well, it might be serotonin. And again, you can treat both if you want. They're very, very safe. Much like vitamins, if you do take too much, you'll kind of know it. So, you may take a certain amount of 5-HTP or the L-tyrosine and you'll notice some improvement. But then if you take more, you'll notice kind of a reemergence of the symptoms that you're trying to avoid, in which case you've topped out and you want to back it down. But it's, from day to day, if you take too much, it's not like you're going to poison yourself. You just adjust your dose tomorrow. There are downstream options from 5-HTP too, which includes tryptophan, other supplements like St. John's wort, SAMe, things like that. But again, consult those books if you don't find relief with 5-HTP. I find that it works really well for me. And in fact, I like it. I can't say it works situationally, doesn't work like a Xanax, or if I take one, I just feel all better in 15 minutes. But I do say that, if I take it for a few days, that my mood improves. And of course, there are many factors. It's not just serotonin and a lack of an amino acid, but usually the 5-HTP is enough to kind of bridge me to where I want to go. All right, two other issues that we have, two other amino acids that we have are GABA. Here we go. And again, I didn't really overthink these brands. I go with brands that I've done my homework on before, and so I just kind of repeat. So all the brands that you're seeing in this video are ones that I've bought, so you can copy up my paper with my homework if you want. But they're not expensive, and they're reputable brands. But GABA is known as brain's natural Valium. It's an Valium? the drug that calms you down. It's an inhibitory neurotransmitter that serves as an anxiety buffer to turn off the production of our excitatory chemicals. So it can really help with our stress response. And you can take it prior to some sort of ordeal. You're on your way to court with your ex-husband. You might hit some GABA for that. But you can also take, I have 500 milligram capsules. You can take it up to 3 times a day. So take 1 dose in the morning, midday, afternoon. I always just kind of allow what's going on for me to regulate. If I think of it, I'll go take it. If I forget it, it's not like I forgot my medication and, I'm going to get pregnant or something. So, again, you can do that up to 3 times a day. And then, and that's for stress. And then finally, glutamine is, this one really helps with cravings. So glutamine is the amino acid that fuels your brain when your blood sugar is low. So you can use this against sweet and starch cravings. You can take it between meals, and that will help stabilize your blood sugar throughout the day. But it's actually really, really helpful in early recovery because 95% of us, even people that are healthy and have good diets and don't eat a lot of sugar, 95% of at least treat alcoholics they've done studies on in rehab. So, we may not have gotten to that extent, but 95% of us in recovery are hypoglycemic. And so our insulin and glycogen responses are weak. There might be insulin resistance or whatever. So this can really help with that. And again, you can take it up to 3 times a day. You can take it as needed. All of these you can. So it's just a really great, inexpensive tool to try, with the only drawback of being, if you're already on SSRIs, you want to do more homework. It doesn't mean you can't take them. In fact, these are used in the tapering and the weaning process. You just don't want to start throwing pills into your mouth without doing your homework, speaking to a professional, talking to your doctor. And if your doctor is, a normal family physician, they're not going to be educated on amino acids. So you might look at your health store. They often have people that work there that, kind of consult, and they're going to be able to give you good information, or consulting a functional and integrative nutrition doctor, or I guess just any MD that's functional and integrative, or a naturopath doctor. There are people out there that do work with these sorts of things, and it's really important to do your homework. Those 2 books are a great place to start, though. And so hopefully you'll find that this information allows you to do the next right thing and keep moving and give yourself some compassion, and hope you'll feel better.